Acne vulgaris is a long-term skin disease that occurs when hair follicles become clogged with dead skin cells and oil from the skin. The rationale for drug use for acne are as follows: to improve complexion, reduce the number of lesions, prevent scarring, limit disease duration, and reduce psychological stress such as depression and low self-esteem related to acne. Among the drugs for treating acne include antibacterials. These include prototype drugs such as clindamycin and erythromycin. Retinoids. Tretinoin, adapalene, or isotretinoin are the treatment of choice for comedonal acne. It may be used with other topical and oral treatments. Irritation may increase with the use of greater than one topical treatment. It should not be used during pregnancy because of potential risk of teratogenicity. The prototype drug is isotretinoin. It acts primarily by reducing sebum secretion. It is used in severe acne or in moderate acne unresponsive to conventional treatment. It is a known teratogen, and pregnancy and blood donation should be avoided during treatment and for at least 1 month after stopping treatment. Azelaic acid. Azelaic acid has antibacterial activity and is comedolytic. It is a less irritating alternative to benzoyl peroxide in mild inflammatory acne. It should be used cautiously in patients with dark complexions since it may cause hypopigmentation, which may be useful if acne has caused hyperpigmented scars. Ectoparasite is a parasite that lives outside the body of the host. There are 3 types of human lice: Pediculus humanus capitis or head lice, Pediculus humanus corporis or body lice, and Thyrus or crab lice, which is found on hair of genitalis. These are transmitted from person to person through social and sexual contact. Scabies is caused by the itch mite Sarcoptes scabiei, affecting the interdigital and popliteal folds, axillary folds, umbilicus, and scrotum. The goal of therapy is the eradication of the causative organisms. The drug of choice for all these infestations is permethrin. Permethrin is a derivative of chrysanthemum cinerarifolium. Recent reports, however, have reported lice resistance to permethrin. An alternative drug is malathion, which is an organophosphate cholinesterase inhibitor that is hydrolyzed by plasma carboxylesterases much faster in humans than in animals, which provides therapeutic advantage. Directions for use of each product varies. What is important is to note the indicated frequency of use. There are products that are indicated for use only once. When reinfestation occurs, reapplication of the drug would be only in a week after the last application, as there are reports of temporary deposition of these in fatty tissues like the brain. The drug after application would take about 5 days to be excreted. Antiseptics and disinfectants are a group of drugs that are enabled to inhibit growth, development, and leads to death of microorganisms in the environment surrounding the patient or on the surface of the body. They have broad spectrum of action, rapid onset of action, small latency period, high activity, high availability, and low cost. They also have a lack of allergic effects, low toxicity, and are chemically resistant. What does differentiate them? Antiseptics are used to eliminate pathogens in the surface of the body, while disinfectants are used for disinfection of medical instruments, equipments, and other things found in the patient's environment. Phenol is the earliest used and works in denaturing bacterial proteins. However, it injures tissues and cells at high concentrations, causing skin burns. Examples are cresol or lysol, chlorocyanol, and hexachlorophene. Oxidizing agents liberate oxygen, which oxidizes bacterial protoplasm. Examples are potassium permanganate, hydrogen peroxide, benzoyl peroxide, a widely used agent for acne. Halogens such as iodine or povidone iodine iodinates and oxidizes microbial protoplasm, as well as chlorine, which can be seen in bleaching agents. Chlorhexidine acts by disrupting bacterial cell membrane and denaturation of bacterial proteins. It is non-irritant and more effective against gram-positive bacteria. Cetramides act by altering permeability of cell membrane. It is widely used for surgical instruments and gloves and sometimes combined with chlorhexidine. Alcohols are common for everyday use and acts by precipitating bacterial proteins. However, it is an irritant, therefore should not be applied on mucous membranes, ulcers, or open wounds. Examples are isopropyl alcohol and ethyl alcohol. Aldehydes are commonly used for fumigations and works in denaturing bacterial proteins. Between formaldehyde and butyraldehyde, butyraldehyde is a better sterilizing agent. Acid such as boric acid is a weak antiseptic and is a bacteriostatic agent. It is used in mouthwash, irrigation of the eyes, and glossitis. Metallic salts. Silver sulfadiazine is active against Pseudomonas seen in burn patients, while silver nitrate is highly active against gonococci.